Greetings, my dear friend. Today we are going to learn general toxicology. I would like to share a case with you. A 54-year-old male was brought to a tertiary care center with a history of gastroenteritis, muscle pain, fatigue, on and off headache, numbness at both the feet, and recent history of alopecia since past 2 to 3 weeks. After all examination, doctors made the diagnosis of diarrheal disease with electrolyte imbalance. Unfortunately, patient expired within 3 days. Subsequently, after 2 to 3 weeks, his wife and daughters were admitted at the same hospital with similar complaints. And the condition of his wife was quite critical, and she expired within a day. The doctors became very curious to know the exact diagnosis, and hence they ordered all the sorts of investigation including toxicological profile. And surprisingly, it came to be thallium in high concentration in their blood. They got curious and they informed the police. Investigation started, and the police found that it was their son-in-law who used to mix thallium compound in their tables since a long period of time for the property reasons. So this is one of the unique case of ideal homicidal poison where doctors can easily miss if they are not skeptical and knowledgeable about the poisons. So it is very important for medical graduates to know about the poisons. So now question is, what is a poison? One of the beautiful philosophical definition was given by Paracelsus. All substances are poisons. There is none which is not a poison. The right dose differentiates a poison or a remedy. Medically, definition of poison is quite specific. It says the poison to be classified should be in a small quantity, it should act within a short span of time, and should have a biochemical basis. So, common salt, if taken in a large quantity like half kg, it can be fatal, but still cannot be classified in poison. Similarly, tobacco over a long period of time can cause cancer and death, but cannot be classified in poison. Air bubble can obstruct the vessels and causing embolism and sudden death, but again it doesn't have a biochemical basis, so it is again not poison as medical definition. However, legal definition is quite broad. Legally, any substance administered to the body with intention to cause injury or death is classified under the poison. So even the needle prick is a mechanical poison. So friends, learning about all the aspect of poison is classified under the branch of science called toxicology. And father of toxicology is Matthew Orfila, who was a French toxicologist, and he worked on the arsenic poisons in big numbers. Further, friends, you should know and remember the classification of poisons. According to the symptoms, the poisons can be classified as corrosives, strong acid, strong alkalis, metallic salts, irritants, organic, inorganic, mechanical, neurotoxics, cardiotoxic, asphyxiants, and other miscellaneous. It can be food poisons or agrochemicals, pesticides, herbicides, rodenticides, fumigants. Now, if a case of poisoning comes, how to proceed for diagnosis? It is important to go in a detailed history about the case and look for the clinical signs. And once you suspect the case to be a poisoning case, then laboratory investigations should be supported, and these laboratory investigations must be sent. Among them, gastric lavage collection is quite important. Here you should know how to collect the gastric lavage sample. The body should be in Trendelenburg position with the head lower than the feet and in the left lateral position. Once you collect the gastric lavage, then you seal it and send it for FSL through the police. And finally, you should know what are the duty of a doctor in case of poisoning. It can be classified in medical and legal duty. Always medical duty is above the legal duty, and saving the patient's life is a priority of the doctor. But legally, doctors are bound to make MLC in all the cases of poison, whether accidental, suicidal or homicidal, either in the private setup or government setup, and give information to the police. Also, you are supposed to preserve all the evidence, clothes, gastric lavage or other relevant samples. Also, you should record dying declaration or assist in recording it if it is required. And in cases of broad death or patient died during the treatment, death certificate should not be issued and the body should be sent for autopsy examination so that exact diagnosis and samples can be preserved. So friends, all these legal duties are penally actionable. So it is very pertinent that medical graduates should know all the procedures and details about the poisons. So this is all for the day. Thank you for your patient listening.